Kidney disease doesn't announce itself. It whispers. Early on, there's little pain and no clear warning, just subtle changes that are easy to ignore. Millions live with kidney damage without knowing it, because the kidneys quietly compensate for years. By the time symptoms are obvious, significant damage may already be done. Early detection can slow or stop progression, but only if the signs are noticed in time. Number 10. Foamy urine. Occasional bubbles in urine can be harmless, especially if urine hits the toilet with force. But persistent foam, thick, cloudy, and slow to disappear, is different. This can be one of the earliest visible signs of kidney trouble. Healthy kidneys filter waste while keeping essential proteins in the bloodstream. When those microscopic filters are damaged, protein begins to leak into the urine. Protein alters the surface tension of urine, creating a foamy appearance similar to soap suds. Many people overlook this change because it causes no pain and doesn't interfere with daily life. Yet protein in the urine is a red flag. It often appears long before kidney disease causes noticeable symptoms elsewhere in the body. A simple urine test can detect this leakage early, making foamy urine one of the most important visual clues your body can give you. Number 9. Blood in the urine. Seeing red, pink, or tea-colored urine can be frightening, and it should never be ignored. Blood in the urine, known medically as hematuria, is never considered normal. In kidney disease, damaged filters allow red blood cells to escape into the urine. Sometimes the blood is visible, and other times it can only be detected under a microscope. While kidney disease is one possible cause, blood in the urine can also result from infections, kidney stones, inflammation, or even intense physical exertion. The key point is this: blood in the urine always requires medical evaluation. Even if it appears only once or goes away on its own, it can signal an underlying problem that needs attention before it becomes more serious. Number 8. Urinating. More often, especially at night, needing to urinate frequently, particularly during the night, can be an early sign that the kidneys are losing their ability to concentrate urine properly. When kidney filters are damaged, they struggle to regulate fluid balance. As a result, more urine is produced, and the urge to urinate becomes more frequent. Many people dismiss this change as aging, increased water intake, or minor bladder issues. But when frequent urination becomes a pattern, especially if it disrupts sleep, it may reflect declining kidney efficiency. This symptom is often overlooked because it develops gradually. Yet in combination with other subtle signs, it can point toward early kidney dysfunction that deserves investigation. Number 7. Swollen feet and ankles. Swelling in the lower legs, ankles, or feet is a classic sign of fluid retention. Healthy kidneys remove excess salt and water from the body. When they begin to fail, fluid accumulates in tissues, most noticeably in areas affected by gravity. This swelling, known as edema, may cause socks to leave deep marks or shoes to feel tight by the end of the day. While swelling can also be linked to heart or liver conditions, kidney disease is a common and often overlooked cause. Persistent swelling is not just a cosmetic issue. It reflects a breakdown in the body's ability to maintain fluid balance and should always prompt medical evaluation. Number 6. Constant fatigue that rest doesn't fix. Fatigue is one of the most common and misunderstood symptoms of kidney disease. It's not the tiredness that follows a long day. It's a deep, lingering exhaustion that doesn't improve with rest. The kidneys play a key role in producing erythropoietin, a hormone that signals the body to make red blood cells. When kidney function declines, red blood cell production drops, leading to anemia. With fewer red blood cells available to carry oxygen, muscles and organs are left underpowered. This results in weakness, brain fog, shortness of breath, and reduced stamina. Many people blame stress or lack of sleep, never realizing that the fatigue originates from impaired kidney function. Number 5. Trouble sleeping. Sleep problems are far more common in kidney disease than most people realize, and they often appear long before a diagnosis is made. As kidney function declines, Waste products such as urea and creatinine begin to accumulate in the bloodstream. These toxins don't just affect physical organs, they also interfere with brain chemistry, disrupting the normal signals that regulate sleep and wake cycles. As a result, people may struggle to fall asleep, wake frequently during the night, or feel as though their sleep is never restorative. Kidney disease is also closely linked to sleep apnea, a condition in which breathing repeatedly stops and starts during sleep. Fluid retention, a common issue in kidney disease, can shift into the neck and upper airway when lying down, increasing airway obstruction. Changes in nerve signaling further contribute to unstable breathing patterns. The result is fragmented sleep, loud snoring, gasping episodes, morning headaches, and persistent daytime fatigue. Poor sleep does more than cause tiredness. Chronic sleep disruption raises stress hormones, increases blood pressure, worsens insulin resistance, and promotes inflammation, all factors that directly accelerate kidney damage. This creates a vicious cycle. Kidney disease disrupts sleep, and poor sleep further damages the kidneys. Number 4. Puffy eyes. Swelling around the eyes, especially noticeable in the morning, is often brushed off as allergies, aging, or a bad night's sleep. However, persistent puffiness can be one of the earliest physical signs of kidney dysfunction. The underlying cause is usually protein leakage into the urine, a condition known as proteinuria. Proteins in the blood play a crucial role in keeping fluid inside blood vessels. When kidney filters are damaged, protein escapes into the urine, reducing the blood's ability to hold on to fluid. As a result, fluid shifts into surrounding tissues, where it becomes visible as swelling. The delicate skin around the eyes is particularly vulnerable, making puffiness more noticeable there than elsewhere in the body. What makes this symptom especially dangerous is its subtlety. It often appears before swelling in the legs, ankles, or abdomen and causes no pain or discomfort. Many people ignore it for months, unaware that it reflects an early breakdown in kidney filtration that could have been detected with a simple urine test. Number 3. Loss of appetite and changes in taste. As kidney function declines, the body becomes less efficient at clearing metabolic waste. These toxins begin to circulate in the bloodstream, affecting multiple systems, including the digestive and sensory systems. One of the earliest effects is a change in taste and appetite. Food may begin to taste metallic, bitter, or unpleasant. Some people notice a persistent bad taste in their mouth, while others feel nauseated without an obvious cause. Even favorite foods can lose their appeal. Many individuals feel full after just a few bites, while others experience a complete loss of hunger. Over time, reduced food intake leads to unintentional weight loss, muscle wasting, and nutritional deficiencies. This weakens the immune system, reduces energy levels, and makes it harder for the body to cope with illness. While loss of appetite is often blamed on stress or digestive problems, in kidney disease, it reflects a systemic buildup of toxins that signals declining filtration capacity. Number 2. Dry, itchy skin. That doesn't improve. Dry, itchy skin may seem like a surface-level problem, but in kidney disease, it often reflects deep internal imbalance. Healthy kidneys help regulate minerals such as phosphorus and calcium and remove waste products that can irritate nerves. When kidney function declines, these substances accumulate in the blood and begin to affect the skin. The resulting itch is often described as deep, intense, and relentless. Unlike ordinary dryness, it does not respond well to moisturizers or changes in skincare routines. The itching may worsen at night and can affect large areas of the body, including the back, arms, legs, and scalp. This condition, known as uremic pruritus, can severely impact quality of life. Constant itching disrupts sleep, increases stress, and can lead to skin damage from scratching. More importantly, it signals that the kidneys are no longer maintaining chemical balance, a fundamental role essential for overall health. Number 1. Muscle cramps. Painful muscle cramps, particularly in the legs and feet, can be another sign of kidney dysfunction. The kidneys regulate electrolytes such as potassium, calcium, and phosphorus, minerals critical for muscle contraction and nerve signaling. When kidney function declines, electrolyte levels can swing too high or too low, triggering sudden cramps that may occur during the day or interrupt sleep at night. These cramps are not just uncomfortable, they indicate systemic imbalance that can affect the heart and nervous system if left unaddressed. If this video helped you understand what your body might be telling you, like and subscribe for more clear, evidence-based health explanations. No hype, just facts that matter.